Hey, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. Today, we have a very special guest, Dr. Larisa Syrow. Dr. Syrow, welcome to the podcast. Why
Thanks
don't
so
you tell
much.
everybody a little bit about yourself?
Hi, everyone. I'm Larisa Syrow. I'm a neurologist and a headache specialist. I really enjoy helping people improve their lives and feel better from their headaches and migraines. I'm certified in headache medicine as well as in general neurology. So I'm happy to tell you all I know.
Awesome. I did not know there was an extra certification for headache medicine, so this will be great. So that is today's topic, migraines. So Dr. Syrow, what are migraines?
So migraines are a type of headaches, although I should qualify that some people have migraine without actual pain. But usually they're known for the severe head pain that can also be accompanied by sensitivity to light, sound, smells, nausea, vomiting, as well as any other associated features such as changes in the vision, numbness, difficulty speaking, and any constellation of that, as well as a whole list of potential other symptoms such as lightheadedness, dizziness, difficulty concentrating, and so on.
Awesome. Yeah, I don't want to get off topic, but I myself suffer from migraines, so I'm definitely curious to hear what else you have to say. So migraines are a little bit different kind of headache. How would you say they differ from like other headaches?
Well, usually the other headache that's referred to as tension type headache. Tension type headache is usually more pressure type of feeling rather than the pulsating, throbbing, pounding, stabbing that usually is associated with a migraine. Tension type headaches tend to be a little bit less severe, although they can still be quite intrusive into life activities. Usually people can still go about their day with a tension type headache as opposed to with a migraine. They need to drop what they're doing and lay down. A lot of headache specialists really think of the two as on the same continuum, just one being on one end of the spectrum and the other being on the other end, because it's really similar type of triggers that can provoke both and similar type of treatment approaches that can help both.
Okay,
There
that
are a
definitely,
few
yeah.
other more rare headache types, which we probably are not going to get into today, such as cluster headaches, hemicrania continua, those types, but they're much more rare, so they require unique management.
Gotcha. So you mentioned triggers. What do you mean by that for our listeners?
So a lot of things can provoke the headache to come. So when someone is predisposed to having migraine or tension type headaches due to usually genetic factors, or say after a head injury, if they're predisposed to having it, then something can bring it on. So oftentimes the common triggers are stress, hormone changes, sleep deprivation, dehydration, and what you're eating or drinking, as well as weather changes. Usually those are the most common
What
triggers.
about like odors or exposure to bright light or anything like that? Does
Yep,
that, okay.
those can absolutely do it too.
So you mentioned hormones. Would that be something like the menstrual cycle for women, perhaps?
Well, it very commonly is menstruation. A lot of women have migraine or other type of headaches right before they start their period or into the first 2 days of the period. But also menarche, the start of period in teenage girls, or menopause is a very common time, or even perimenopause, even right before the full-on menopausal symptoms. Around pregnancy, the migraines can change as well.
What about, you mentioned food or drink. Are there any specific items that people should look out for?
Sure. Just one thing that I recalled regarding the hormonal changes, birth control pills can be a major factor. Some can make the migraines better, some can make them much worse. So that's something to consider. Regarding foods, absolutely. So it really is important to to use food to fuel as a fuel and for energy and as nutrition, because if we use food for just like fun snacking, sometimes those can be triggers. So what I mean by that is foods that have preservatives like MSG or nitrates that are in sausage, bacon, hot dogs, cold cuts, artificial sweeteners like NutraSweet's Blend the Equal. Most beverages, non-water beverages out there, have something in them that can trigger migraine. Sports drinks, energy drinks, sodas, juices, often have something. So those are usually the food type of triggers. Of course, there's a long list that's you could easily find through Google search.
So yeah, avoiding, processed foods, fake
Mhm.
sugar, real sugar definitely is something I mentioned to my patients, but maybe not as much for headache improvement. So that's really good to know. What
Yeah.
about alcohol?
Yes, that's a common trigger for a lot of people. Mhm.
Yeah, some say red wine is, I guess helps it, but others people that's like a big trigger, I think.
Yeah, I think
Yeah.
it's the way, I don't know the intricacies, but I believe it's the way the wine is made and whether there are tannins present. I think that's something to look into if someone has migraines and particularly would like to drink their wine.
Yeah. You mentioned genetic susceptibility. So
Mhm.
what do you mean by that? And who is at risk for migraines?
Well, genetic factors are very common. Even if the person does not know anyone in their family who have migraines, it's still often genetics that make someone susceptible. But we do see it very frequently run in families. So the reason why I say that they may not know someone, well, first of all, it can skip generation, but also they may, say their mother might just say, oh, it's not a migraine, it's a sinus headache or something like that, or
Yeah.
it's just a period or a stress headache, but it could still be like in the migraine family or a migraine type of a headache, and hence the genetic factors.
Yeah, actually, so I'm one of those very lucky people where I get them from both sides. So from my mom and my dad, and they get them for different reasons. So that means I get them for all of their reasons. So the triggers, are a lot more lengthy and listing for me. So you mentioned some treatments and kind of what you would do. Do you want to comment on how you treat migraines?
Sure. Well, the number one thing is to go back to lifestyle things that we were just talking about. Really, the best treatment is prevention. So, um, first of all, I ask my patients how well hydrated they are, to drink at least 8 glasses of water a day, to ask what they're eating and drinking. So, making sure that they're eating nutritious foods, fresh fruits and vegetables, less processed foods, less foods that have the additives that we were discussing. I ask my patients how well they're sleeping, because sleep deprivation can be a factor. And we might discuss sleep hygiene as a way to help their migraines. How well they're managing stress. So stress is not necessarily avoidable, but the way we manage it can be a key. For example, doing yoga, which is like mind body, or Tai Chi, which involves stretching of the muscles of the neck, which is helpful for migraine, as well as that mind body component can be extremely helpful. Or doing meditation, where there are a lot of really nice apps on the phone for meditation that can be helpful for migraine. Also, maybe seeing a counselor for even for short term can be helpful for migraine prevention. Keeping a headache diary can also be very informative. There's some nice apps for that as well, to understand the triggers, to be able to avoid those triggers, whether they're food or activity related. And then certainly there's a lot of things by prescription. But before prescription, there's also natural supplements that I discuss with patients. So usually, if someone is open to it, if they haven't tried medications, we would usually start with natural supplements like vitamin B2, which is riboflavin at 400 milligrams daily, magnesium in various forms, 400 milligrams daily, or CoQ10, 200 milligrams daily, can be very helpful for migraine prevention if taken every day over a couple months. Sometimes it's things like ginger and turmeric as like a self-brewed tea, or essential oils through like a roll-on or infuser of like peppermint or lavender, for example. So sometimes it's natural, healthy ways that can help decrease migraine. And certainly there's a myriad of prescription options.
Mhm.
Would you like me to go over
Sure,
anything?
yeah. So there's just some of those supplements I wasn't aware of. I mean, I definitely
Yeah.
have recommended magnesium in the past, but that's super helpful to know that there's something that you can start with rather than jumping right to those prescription ones. So speaking of
Yeah.
that, we can briefly talk about that too. I don't know how much our listeners would know about that, but so let's see.
Well, if for people who are particularly interested in not getting a prescription medication, or if they haven't seen a doctor, another thing that one can obtain on their own is a device called Cephaly. It's available without a prescription, and it's used both to prevent migraine and also to like break the pain when it comes. It's over the counter. It's a little bit on the pricey side, but can be worth it for people with frequent headaches.
Yeah, I was hoping you would bring that up because I had some friends that had asked me about it and I hadn't heard of it before, but I have actually been recommending it to patients since they've had really good success with the device. So they were using it as preventative, but also for treatment, like you said. Yeah.
Yeah, it's been out for over
I'm
10
just going to
years.
spell it. It's CEFALY, right? And just in case anybody wants to go look it up on the internet. I'm not sure
Yeah,
of the
it's
cost
FDA
though.
approved. It's
Mhm.
$400 one time to get the device, and then there occasionally to replace the leads, it's about $20-$30.
Oh, okay. That's good to know. It is a little steep, so
Yeah.
yeah, very interesting. Okay. So what any other non-medical or non-prescription things?
There are other devices, but they are by prescription.
Mhm.
Um, those are the main ones. Those are the main ones short of getting a medication prescription, I would say, aside from all the over-the-counter things that are available.
Mhm.
So, and we can start with that because usually that's the
Yeah,
go-to,
good
right?
point. Absolutely.
So I just want to kind of preface to make sure that people understand there's two main categories of treatment when it comes to migraines. There's the preventive treatment, and then there's the rescue acute abortive treatment. So preventive is something that's in the system every day, whether you have a headache or not, to prevent it from coming in the first place. And then the rescue treatment is something that one takes on occasion when a bad headache comes. So usually people take like the NSAID category, meaning like something like ibuprofen or naproxen, or the combo medications like Excedrin over the counter before seeing a doctor. And those are okay if someone has headaches or migraines on an infrequent basis. I would just caution when people take them too often, because taking those kind of medications at least 10 days a month can contribute to more headaches in the long run, and cause something called medication overuse headaches, sort of like a rebound type of pain. So and especially with caffeine-based medications like the Excedrin, which is acetaminophen, aspirin, caffeine, there's that caffeine withdrawal aspect.
Mhm.
Um, which I should also sideline that I often ask patients when we discuss their lifestyle in relation to headaches is how much coffee they're drinking, because yeah, I know that's hits home for a lot of people. I
Yeah.
see you smiling. Caffeine on an infrequent basis to treat the headaches, it can be a good tool, but caffeine on a regular basis can contribute to headaches, contribute to more headaches, partly because it's dehydrating, partly because it can cause the withdrawal. That cup of coffee in the morning does not last 24 hours, and that withdrawal can bring on a migraine. So to go back, we were saying the Excedrin or the caffeine combo treatments, be careful with those. Or overusing anything by prescription or over the counter. So in terms of preventives, there are many different types. There's the older, more traditional type of preventives. I'm just going to list a few. Amitriptyline, nortriptyline, topiramate, propranolol, those are venlafaxine, those are some common ones. There are others. And then there's newer style preventives that are the anti-CGRP class of prevention. And those are either by injection, Aimovig, Ajovy, or Emgality, or by pill, Nurtec, or Qulipta. And then, so those are the preventives.
So
And
when
then,
would you, sorry, I didn't want to interrupt,
yeah,
but
sure.
when would you put a person on a preventative versus what you're about to talk about with the abortive ones?
Well, anytime someone finds themselves taking too many rescue medications, then, and too many is a relative term. So for some people, it's once a month is too many. For some people, it's over 2 times a week is too many. Certainly over 2 times a week, that would call for preventive. But anytime the rescue medications are causing side effects or they're not working, that would also be a reason to take preventive.
I just assumed it was because the insurance only let you have 9 of the abortive ones at a time. So it had to be, you know, more than 9, and then you would qualify for a preventative medicine. I'm not sure.
That's a good way to go about it. But the reason why they came up with 9 was because of that 10 that I mentioned, because over 10 days, a month of certain rescue can put
That's what I meant,
you in the medication overuse headache. So yeah.
Yeah. Yeah. So what are some of the abortive or you rescue medicines that you're calling them?
So we talked about the over-the-counters, like the ibuprofen. I think of those of the over-the-counter, naproxen seems to work the best, which is like brand name Aleve. So I would go to that first. But in terms of prescription, I think a lot of people know about the triptan class of medication. So most common of which is sumatriptan, but there are also many others: rizatriptan, naratriptan, frovatriptan, zomatriptan. So they're all end with that triptan ending. And then there's also newer medications that are non-triptans that are anti-CGRP, such as Ubrelvy, Nurtec, and then there's another class called Rayvow, so as well as another class called Trudhesa, which is a nose spray. So there are newer options from that
Speaking of
category.
the nose spray, I was going to say there are definitely different formulations of all these medications, correct?
Yeah. So for the prevention, there's pills, there's self-injectables. Obviously, there's the devices that we talked about. Some people for prevention, I should have mentioned, also get injections by their providers, such as Botox injections or nerve blocks. So that's something to go to the office to have those administered for prevention. For rescue, there's pills, nose sprays, under the tongue dissolvables. Those are the most common ways, and rare forms of self-injectables.
Yeah, I've had to use those self-injectables once upon a time in residency training. And
Mm-hmm.
luckily I had a roommate do it for me.
Yeah, that can
Yeah.
be tough.
So before I guess I change the subject again or move on, is there anything else you wanted to say about the treatment of migraines?
Well, what I think that when people come to me as a headache
Mhm.
specialist, I would say that it's not that I do anything really unique. It's that I'm just aware of more treatments out there and I'm more assertive maybe in terms of going after the migraines, whereas
Mhm.
um, a general doctor who's maybe not in the know about the different options, or they may assume that if someone tried and did not respond to uh, 2, 3 common options, that means that all hope is lost. I never think like that. I think there's so much out there. Sometimes a certain pairing of medications. Sometimes it's going back to the drawing. A lot of times it's going back to the drawing board and thinking about what can be addressed in the lifestyle part of
Mhm.
the conversation, like hydration, what someone's eating, the sleep, the stress. Um, so really, honestly, there's really no magic potion there. It's kind of the combination of which medication might suit best, and it may take a few trials, and what someone can do in terms of healthier living.
What do you do when it won't go away? Like they've had a migraine for days or hours, or what do
There
they
are
do?
some medications that we might prescribe from the at those times. Sometimes a steroid pack can be helpful. Sometimes certain nausea medications, like metoclopramide, which is Reglan, or Compazine, which is prochlorperazine, can be helpful. Sometimes it's a trip to the emergency room because IV medications can be helpful. Um, that common term migraine cocktail, which is a combination of medications uh, like one of the nausea medications that I mentioned, with diphenhydramine, which is Benadryl, and Toradol, which is ketorolac, can be a powerful combination provided
Mhm.
in the emergency room. Um, yeah, drinking lots of water, doing there's a lot of like meditation or self-hypnosis to or biofeedback to help lower pain. So doing that approach can be very helpful.
Mhm.
Just laying down in either a cool pack, many people find, or a headband, some people find can be helpful. As I mentioned, the essential oils or um,
So
something.
more about that. I just thought they had like certain odors and it might actually trigger a migraine. They actually can help migraines, the essential oils.
Well, everyone tolerates things differently.
Mhm.
So for some people, certain smells can be quite triggering, but usually because it also depends on the type of essential oil and the quality.
Mhm.
But if the ones that are like good quality, natural, then they often helpful as opposed to something like smoke or perfume, which is like a synthetic type of a smell that's
Mhm.
more triggering, but it
Okay.
isn't an individual thing.
So, do migraines put you at risk for anything? If you suffer from migraines, are you more likely to have a stroke, or what do you think?
So I think that just having a garden variety migraine does not,
Mhm.
or if it does, then the risk is quite small compared to someone who doesn't have a migraine. But the risk does increase if someone has a migraine with aura, meaning the additional features of significant changes or prolonged changes in the vision, or numbness or speech, or with weakness associated with migraine, especially in the setting of taking certain types of birth control pills, or
Mhm.
smoking, or being over age 35, and also other if someone has other stroke type of risks like uncontrolled high blood pressure, um, cholesterol, diabetes, etc. So it's not the migraine itself, it's kind of the combination of risk factors. What else is going on besides the migraine?
Okay, that's good to know. I definitely counsel patients above 35 that come to me that have, migraine with aura, that we should probably not be on those oral contraceptives anymore.
Well, that's a question that comes to me as well. It's not necessarily a blanket statement for all oral contraceptives. If the first of all, there is progesterone only contraceptives, and there's also the non-hormonal IUD. But also, if the person needs estrogen-based birth control pills due to other reasons, like, I don't know, endometriosis or something, then sometimes a low estrogen may be okay. And it also depends on how well the migraines are controlled, even migraine with aura. If they're occurring less frequently, then that may be okay with a lower estrogen. So it's kind of taking everything together.
Right. Definitely there are exceptions to the rule. I see. Yeah, what you're saying there. So that makes sense too. Do you have any other comments or any things else that you wanted to talk about?
I think that people with migraine really suffer, not just because of the pain, but also because they can look really well, even though they're having their discomfort. And sometimes it's not obvious to people around them that they really are having this really unpleasant pain and other symptoms. And it could be difficult to prove to the rest of the world that they're having this. And so I really sympathize with that. I understand how tough it can be, especially in those situations, especially when the migraines are more frequent. I would say just know that there's a lot that one can do to have them under better control, especially more recently. There's so many new options. And both in terms of like more realization about like a lifestyle alteration, but also so many new treatments like by prescription. So, keep going for getting better health.
Absolutely. Yeah. I think one thing I definitely learned was that I can focus more on the lifestyle improvements for patients. I mean, I mentioned things, but you mentioned a whole lot more, especially like the de-stressing things. And you mentioned some apps. I think I often tell people the app Calm or Headspace are good for those kind of mindfulness and meditation apps that are useful for people to help maybe if they have stressful migraine associated with stress. Yeah.
Yeah.
So where can our listeners find you if they, want to work with you or follow you or
So I'm in telespace. I don't have a physical office, but I'm affiliated with Cooper Hospital, which is in Camden, New Jersey, because I used to live there and then I moved. So that's why most patients who I see are from New Jersey, and I see them through telemedicine. So it's a little tough otherwise. So
are you
if you
licensed in Florida?
I am.
Okay.
So if someone is registered through Cooper Hospital, which they can be actually as a Florida resident, they can see me through telemedicine. That would be fine. I do have a medical license in Florida.
Nice. Well, super helpful. Thank you so much for coming on the podcast.
Pleasure.
So any last remarks or no?
Well, I thank you so much for inviting me to speak. It's my pleasure. I'm happy to come back and tell you more about migraines anytime.
That would be awesome. Yeah. All right. Well, thank you everyone for listening to the Get Healthy Tampa Bay podcast. I hope you will join us for next week's episode. Don't forget to share this episode with your friends and family and review us on iTunes.